have watched this body over the last period of time if we discussed health care, and the body itself has been, the integrity has been challenged of this body. I've watched as individuals have challenged each other's integrity as it relates to this bill. Mr. President, I choose not to do that today, and I want to state, as I state constantly back home in my state, that I consider it a privilege to wake up each day and come to work in this body. Obviously, things don't always go as one might expect, but I do consider it a privilege, and I thank the folks back home for allowing me to serve in this body and to deal with these important issues. Mr. President, I don't think I'll ever quite understand why this bill was put together the way that it was, and I certainly understand there are differences of opinion and differences of interest, but I don't think I'll ever understand why Medicare monies, an insolvent program, are used to fund a new entitlement. Finally, CBO has come out this morning very clearly and stated what we've been saying for over 6 months in this body, that the fact is that taking Medicare savings and using it to create another entitlement does not work. It takes away from the solvency of Medicare itself. It's kind of late. I'm glad that CBO has actually come out and said today, finally, after months of debate, what we've been saying from day one, that you could not take Medicare savings and use it to create a new entitlement without challenging the solvency of Medicare itself. I will never understand, Mr. President, why that building block, a flawed building block, was used to create this bill. And I think that everybody knows that it was that use of inappropriate funding that really began this whole partisan divide. My guess is we might have ended up with a bill that would stand the test of time had we not utilized that basic flawed building block in this bill. There's been another one, though, Mr. President, that I have found equally problematic, and that is the whole issue of creating an unfunded mandate for the state of Tennessee and for states all across the country. As a matter of fact, I think the challenges to people's personal integrity has been centered more around this issue than anything else, as various senators trying to protect their states from an unfunded mandate have been challenged in that regard. Many of the people who serve in this body used to be mayors. They used to be governors. They used to be people who had to deal with budgets in their own states. And so years ago, in a bipartisan effort, a bill was passed to ensure that we here in Washington didn't pass laws that increase cost for cities. I was a mayor of a city. For states, I was commissioner of finance for a state, and there was nothing that was more offensive than for the federal government to pass a law and to send down a mandate to a city or a state that costs money, and yet not send the money that went with it. There was nothing that was more infuriating, because we had to actually balance our budgets. We didn't have the ability to borrow money from overseas and could continue to operate in the red. So, Mr. President, back in 1995, a law was passed called the Unfunded Mandates Reform Act. And it was done to do away with the arrogance that existed up until that time, and unfortunately continues to exist, where the federal government would create laws that would increase cost on cities and states. It was passed in a bipartisan way. As a matter of fact, 15 members from the other side of the aisle supported this law, voted for this law, and put this law in place. As a matter of fact, many of the people who made this bill, created this bill, participated. The chairman of our finance committee voted for this law. The majority leader voted for this law. The distinguished chairman of the budget committee, who just spoke, voted for this law. The chairman of the health committee, the health, education, labor, and pension committee that drafted a big part of this bill, voted for this law. And what this law said was that we could not pass legislation out of this body, out of Congress, that placed an unfunded mandate on states, on cities, and caused them to have to do things that raised expenses by laws that we created without sending the money themselves. Our governor, the governor of the state of Tennessee, is a Democrat. He's on the other side of the aisle. We've worked closely on numbers of economic development issues. I've talked with him all the way through this process. He actually had hoped to work with this administration on health care and on health care legislation. He has been involved in health care all of his life. He's managed our state well. He's dealt with many challenging health care issues in the state of Tennessee. Much has been documented about the travails that our state has had as it relates to Medicaid and our desire to try to fix that. Mr. President, he has called this bill, which appears to be readying to pass this body, he has caused this bill to be the mother of unfunded mandates. He has talked about the $750 million in cost that this bill is going to cause the state of Tennessee to deal with at a time, by the way, when they're hoping that their state's revenues will be at 2008 levels by the year 2014. So, Mr. President, again, I'll never understand why we have raided an insolvent entitlement to create a new entitlement, weakening Medicare. I'll never understand why we have done that to create this bill. And, Mr. President, I will never understand why this body chose to create such a large unfunded mandate for states around this country through the provisions that we've put in place as it relates to Medicaid, telling states that they have to raise the levels at which they insure citizens across their state from 100% to 133%. Mr. President, there is no question that this bill violates. Okay. Mr. President, there is no question that this bill violates the law that was put in place in 1995. The
senator has 2 minutes remaining.
2 minutes left. Thank you. That's perfect timing, Mr. President. And for that reason, Mr. President, and again, I talk about the fact that it is a privilege to serve in this body. I think, generally speaking, people tried to live up to the standards that this body has set for all of us and that our citizens across this country expect us to live up to. For that reason, Mr. President, I'm going to raise a budget point of order because there is no question, per what CBO has said, the fact is that this bill is going to cost cities and states to pay more for the health insurance of their employees. CBO has stated that clearly. And there is no question that this bill is going to cause states to have to utilize dollars that otherwise might be used for tuition. So for that reason, Mr. President, I raise a point of order for Section 425A2 of the Congressional Budget Act of 1974 makes it out of order to consider any legislation that contains an unfunded intergovernmental mandate in excess of the statutory limit unless the bill provides new direct spending authority or includes an authorization for appropriations in the amount equal to or exceeding the direct cost of such mandate in the Senate. The pending bill includes an unfunded intergovernmental mandate in excess of the annual statutory limit of $69 million within the next 5 years. Therefore, I raise a point of order against the bill pursuant to Section 425A2 of the Congressional Budget Act of 1974.
Mr. President.
I raise a point of order against the pending substitute amendment pursuant to Section 425A2 of the Congressional Budget Act.
Mr. President.
Senator from Montana.
Mr. President, I move to waive the point of order for the consideration of the pending legislation. I ask for the ayes and nays.
Is there a sufficient second? There appears to be. The ayes and nays are ordered.